Hi viewers, myself C. Sumathi, Assistant Professor, PG and Research Department of Biotechnology, JJ College of Arts and Science, Autonomous, Pudukkottai. Today we are going to discuss about organization of laboratory. In that, first we see what is the role of lab services. Once upon a time, the hospital laboratory was a small, dark, and chemicals located in the bowels of the hospital next to the morgue. But nowadays, the scenario is changing fast. Its image and emerging as a high tech with lot of digitalization. Medical technologists and technicians no longer hurdle over racks of test tubes. Instead, they work in brightly lit air conditioned labs, monitoring and maintaining sophisticated laboratory analyzers capable of running hundreds of patient samples each day. Laboratory importance. Laboratory services are essential to healthcare delivery. The lab offers the convenience of local service and familiarity with both the patient and their physician. The addresses both preventive and curative activities, that is, patient diagnosis and the selection of drugs for treatment. They are also an indispensable tool in the surveillance and control of diseases. Improved disease recognition will improve the accuracy of statistical reporting, thus effective national health planning. How to plan? First, we have to plan the laboratory. Successful laboratory services is one that comes from careful planning and designing to meet current and foreseeable needs of personnel, equipment, and spaces. There are some key elements of planning for laboratory. What are the key elements of planning means? There is three key elements. One is manpower, second one is workplace and infrastructure, third one is facilities and equipments. These are the key elements of planning in laboratory. Models of infrastructure depends on type of services to be provided. There are a lot of models in the infrastructure. In that first one, traditional closed laboratory. The traditional laboratory has discrete sections in hematology, chemistry, microbiology, and blood bank, generally separated into rooms or sections. The model of open laboratory, the discrete services are placed in one large room with portable walls that can be adjusted as needed. And in the case of core laboratory, hematology and chemistry, that is hematology. This is the core laboratory model. In that, only two divisions, hematology and chemistry only. Then regional laboratory, low volume or expensive laboratory services consolidated into one hospital. Then remaining models of infrastructure, in that there are reference laboratory, the traditional full service laboratory that handles all types of testings. In this laboratory, the clinical samples, then blood bank, um, and all type of samples are handled in this type of laboratories. Then point of care. In that infrastructure, the tests are at patient's bedside. That is, the services in the home. Whenever the patients are not able to come to the laboratory, the executives or technicians, they are working in the laboratory, went to the patient's home and do the services. This is the point to care of services. Then STAT laboratory. The rapid response lab often located near an emergency department. It provides critical lab tests, example hematocrit and blood gases. Then limited services infrastructure in the limited menu of routine and or specialty services. Specialty services. Laboratory infrastructure. The laboratory infrastructure depends on the following area. What are the following features? First one is size, second one is location, third administrative area, functional area, auxiliary area, and environmental surroundings. These are the factors which are used to determine the laboratory infrastructure. Based on these factors, we can conduct or build up a good laboratory infrastructure. First, laboratory size. The size depends upon the function of laboratory. If it is a clinical laboratory, the need for functional area is very essential to diagnose the samples freely. The minimum requirement for each unit are 10 feet width and 20 feet length. These are the each sections size. That is the minimum requirement for each unit for 10 feet width and 20 feet length. Then the location. Lab should preferably in ground floor. Easy access to indoor emergency. Different subunits may be located at emergency unit, small unit for sample collection, main central unit and morgue. Central unit collection. It is centrally located. Space required depends on type of collection, workload and drainage. Minimum capacity of 150 to 200 patient collections. Then that various components are also included. Special services and guidance, registration counter with token system, fingerprint collection area, then IV blood collection area, the intravenous blood collection area, collection of urine and stool. And morgue. This area specially for collection of body specimens for histopathology like body tissues and viscera. Then central lab unit. Next infrastructure in laboratory is central lab unit. In that central lab unit, there are four divisions in it: administrative area, auxiliary area, ancillary area, and at last functional area. Administrative. First one is administrative area. Office of pathologist, then administration office and patient waiting area. These are all comes under administrative area. An auxiliary area. In this area, there is a glass washing area, the cleaning of instruments, equipment sterilization. The sterilization instruments are kept inside this area. Then ancillary area. In that area, the specimens disposals, and there is a separate cabinet for chemical and reagent store. There only we can keep the or store the chemicals and reagents. The last central lab unit, functional area, biochemistry, microbiology, virology and immunology, cytology, hematology, histopathology, blood bank, stool and urine. These tests are based on this area was conducted in the functional area only. And next is environmental planning. The floor should be strong, acid and stain resistant, grease proof, grease proof. Then walls washable light color, waterproof, no crevices. As far as possible, we can sure about the natural light. Then adequate ventilation and exhaust system, spotlight, no extension cord, sufficient electric points. These are the basic things, and also some other things also needed. The special investigation area to be air conditioned, working benches that is sitting type that is 30 inches height. Then revolving tools means standing type 36 inches height. Then 3.5 feet space between the two benches. Every two benches having the gap between the two benches is 3.5 feet. Then water sink, hot and cold water supply, compressed gas burner. This is also a need in environmental planning. Then next we discuss about functions of lab. The laboratories are the pillars on which quality of medical diagnosis is based. It provides adequate, accurate, reliable, timely diagnostic support, patient management, prognosis, and screening. The next, follow up therapy. It helps in carrying out various researches, training and education of medical students and staff. These are the basic functions of the laboratory. These are the functions of the laboratory. There are a lot of equipments needed to run the laboratory. The types of equipments depends on the types of investigation. But now we are discussed here some basic equipments that are very essential for a laboratory. The common equipments are ESR tube, HP meters, that is hemoglobinometers, WBC, RBC counting chambers, microtones, autoprocessor, microscopes, incubators, calorimeter, slides, spectrophotometer, centrifuge, microbalance, tubes, reagents, chemicals, auto analyzer, semi auto analyzer, blood gas analyzer. Then other equipments are water bath, hot air oven, autoclave, incubator, pH meter, ELISA reader, tissue processor, microtome, wax meeting bath, then hot plate. These are the some equipments which are very essential to carry out the diagnosis process or any other test which are handled in the laboratory. The organization functions. What are the main functions for the organizing the laboratory? Lab administration, provision of services, procurement, storage of reagents, chemicals, quality control, calibration, technical evaluation and supervision, control pilferage, maintenance of records and registration. These are the functions of organization. What are the quality controls in lab services? It is a surveillance method where the skills of the performer, performance of equipment, and material used are synthesized together to produce diagnostic report to assist the physician in diagnosis. The output of the process must conform to pre-established norm or standard. It emphasizes on the skills of the performer, technical procedure and process. Performed to the process means which is performed to achieve the desired result. It is a statistical system for measuring the reproducibility of degree of precision in lab procedure and its constant improvement. Objective of the quality control is to develop a quality assurance system having continuing quality improvements. These are the qualities which are maintained in lab services. That's all about organizing a laboratory. Thank you all. Thank you for watching.